Well, many times you hear people suffer from heartburn. Well, there's a Heartburn Center that can maybe give you some help. Joining us today to tell us more about it, we have Ashley Meyer. She is with general surgery with Grandlake Heartburn Center. And then we have Jill Faulkner. She's the office coordinator with the Heartburn Center. And thank you both for joining us today.
Thank you so much for having us.
Okay, so first of all, let's establish exactly what is heartburn. How do know people have it?
Heartburn is a symptom of gastroesophageal reflux disease most commonly. However, heartburn can also mimic other disorders such as achalasia, which is a loss of motility within your esophagus.
Okay, so obviously this kind of hurts, and I think most of the time people reach for Tums and that kind of thing, right? How do you know when you're beyond that and you maybe need to come visit you guys?
So when our patients come to see us, a lot of times either one, they've been self-medicating or medicated by a healthcare provider for quite a long time, months, years even. A lot of their symptoms that they describe are a burning sensation up here in the chest, commonly referred to as heartburn. Another symptom is regurgitation, where they're having stomach contents coming up, and a lot of times they can feel that in the back of their throat, gives them a sour taste. And then another common symptom of gastroesophageal reflux disease is esophageal dysphagia, or difficulty swallowing, where people feel that food is slow to pass or it's getting stuck. So then oftentimes people are treated with a variety of medication to help suppress their acid production. Tums is one that people often reach for over the counter. There's Pepcid, famotidine, and then the PPIs, or proton pump inhibitors, which are meprazole, Nexium, Prilosec, pantoprazole, Protonix. So when people have been on those medications for a long period of time, then we recommend being evaluated to make sure that truly what's going on is acid reflux or GERD, and not a different condition such as achalasia, which is treated completely differently. Another reason that someone would need to be seen is if they've been on these medications for quite some time and they're continuing to have symptoms despite the medication. If anybody's having that esophageal dysphagia, where that food is getting stuck or difficulty with passing food, that's another reason, because the cause of that could be due to a narrowing of the esophagus due to repeated exposure of acid in the lower part of the esophagus. So any of these symptoms, or if these issues are going on, any significant family history of Barrett's esophagus, esophageal cancers, gastric cancers, we would also recommend being evaluated for.
Well, besides the fact that it must be uncomfortable for someone to suffer from this, I assume that in the long term, if you just let it go, that is not good for you, that it could tumble into other issues too?
Correct. So being on a PPI long-term does have potential long-term side effects. So being sure that you truly are taking that medication for a true disorder and not something else is really important. And then also, if people are not accurately treating or suppressing their acid appropriately enough, it can cause things I discussed, Barrett's esophagus. That's where you have abnormal cells in the esophagus, and it can increase your risk of esophageal cancer. And untreated acid reflux or GERD disease can cause issues with the motility or the squeezing ability of your esophagus.
So, Jill,
not to mention that people, we want them to be comfortable and be able to do the things that they want to do and live the life they want to live and eat what they want to eat without having all of these symptoms.
Right, yeah, life's too short. You want to be able to enjoy all that. So, Jill, you said the center's recently been open, so tell us more about that. And what kind of reaction are you getting from people who are coming?
Sure, yeah, so the center opened in December of 21. It is a state-of-the-art diagnostic center to the workup of GERD, achalasia, other motility disorders that Ashley just talked about. Our team consists of Dr. Lance Bryant and Dr. James Riker, as well as several nurse practitioners and myself as the nurse coordinator. I am there to educate patients, coordinate all of their care, all of their appointments, and let them know just what the repercussions of a GERD disease. We opened it based on a need that we found in the community, and it has been quite well received, I would say. Since December, we've seen many patients. We've been able to take many patients off of acid suppression medication due to the findings that we found through the workup, because they didn't in the end have what is known as acid reflux. They had that achalasia or motility disorder. We've also been able to help patients completely control their GERD due to either something as severe as a surgical option because medication was no longer working, or we also manage their long-term medications so that we can keep their acid suppressed.
Mm-hmm. Yeah, I mean, you must see great smiles on people's faces when they're done, and you like help them out because they can eat what they like, and they feel better then.
Mm-hmm. Yes, yep. It is a lifelong debilitating disease that once controlled, it is life-changing for those patients.
All right. So do you need to be referred, or can you say, I've been dealing with this issue. Can you take a look at me? How do you get some help from the Heartburn Center?
Sure. So referrals are not required unless your specific insurance carriers require them. We can take referrals from your primary care or family doctor, but if you are in need, you are more than welcome to call me at the center directly. I can give you that number, and if they feel the need to be worked up, we'll schedule a consultation with any of the providers involved, and we will get things going for them.
Thank you guys both very much for telling us all about the center today.
Sure. Thank you for having us.
All right, don't go away. New Edition continues in a moment.